the last among all this, you can say least high yield, or it is also high yield, but among this in order, this is also important, but in this order you can call it little less important. These are all important. So energetics is also last thing you must see. This energetics, what energetics means, where ATP is synthesized for substrate level phosphorylation, where step where NADH is produced, FADH2 is produced. An easy way to remember that, kinase step, you will find phosphorylation, substrate level phosphorylation, and then dehydrogenases, you will find NADH and FADH2 production. It's simple to remember, okay, if you know enzyme. So this application level you have to focus. That is why I have actually arranged the same thing into disorder, deficiency, okay, poison inhibitor and regulation. I have provided you tables on each of this. So first, let's begin with the disorders. In disorders, you have seen these are the disorders we have discussed till now. Do you remember them? Do you remember lactic acidosis? So lactic acidosis, I told you, it shows anaerobic respiration is going inside your body. Okay, that means pyruvate is somehow diverted towards, it is not, the metabolism of pyruvate is not happening. Pyruvate is converted into lactate. So metabolism is defective somewhere after pyruvate degradation. So now you can understand this concept better. So this can be because of high glycolysis rate. It can be because of anywhere blockade, anywhere. Okay, any enzyme deficient beyond glycolysis. This is very important point. Many questions asked from this point. They will put 3 options from glycolytic enzyme and 1 option they will put other enzyme. Then you'll have to pick that option, other option. Which of the following will cause lactic acidosis? The enzyme except glycolysis, after glycolysis, rather than telling except after glycolysis. So these are the enzyme pyruvate dehydrogenase, okay, enzyme of TCA cycle, electron transport, they will cause lactic acidosis. Is that clear? So it's simple. You have to remember this. Lactic acidosis will cause.
So you said the enzyme afterwards will cause lactic acidosis.
After glycolysis, after glycolytic enzyme, you can call it after pyruvate kinase. Okay. You got me? After pyruvate kinase, what enzyme comes? Pyruvate dehydrogenase. Okay. Then enzymes of TCA cycle. Then comes electron transport. Any of them, if even a single enzyme is defective, it will cause high lactic acid in your body. Is that clear? Okay. So now second is MODY. So we have discussed, and see, I have also given one question on this. Okay. So few of them, like 50% of you have made it correct, 50 to 60% I see. But most of you, like 40%, they did not answer. Now I think you'll be able to answer. So MODY2 is, it's marginally high glucose level, you will see. There will not be other problem, okay? So it is autosomal dominant. So I've seen presentation, what are the presentation you will find, and then pathogenesis, so how this disorder happens. So age after 20. Generally, autosomal dominant disorder, they present after 20. You have to remember, this is a general rule, okay? Do you know that, this rule? Do you know this rule?
No, sir.
This is a rule, autosomal dominant condition. They generally present in heterozygous condition. You know that? The autosomal dominant also present in heterozygous. When it is heterozygous, it generally present after 20. So this condition will present after 20. Generally, no treatment is required. Okay. Sometimes treatment is required during pregnancy. So what is the pathogenesis? Pathogenesis main thing is gene mutated. Glucokinase gene is mutated. That will result in high glucokinase. Actually, glucokinase affinity for glucose will reduce. That means Km will become high. So now glucose will become, will have less affinity, or you can say reluctant, little more reluctant to touch on glucose level. So the glucokinase were, let's say it was acting on when the concentration used to rise above 100, glucokinase used to take up the glucose. Now, when glucose concentration becomes more than 125, then only glucokinase will take up the glucose. That is why marginally high level of glucose will be there. So this is the pathogenesis of glucokinase. Now, pyruvate kinase. This is another very important disorder. So this pyruvate kinase deficiency will lead to reduced ATP production. Okay, you can see this is the pathogenesis. So I'll go to the pathway. There is some pathway. Okay, this is pathway picture. Can you see?
So pyruvate kinase deficiency doesn't cause lactic acidosis.
No. Pyruvate has to form. If pyruvate has to form, pyruvate converts into lactate. Don't you know that? If pyruvate kinase is deficient, how can pyruvate will be produced? Do you think pyruvate would be produced? No, no pyruvate will be. If no pyruvate, no lactate. Did you get me?
Yes, sir.
Okay. So what will happen? Let's say pyruvate kinase deficiency. This enzyme is deficient here. Okay. So what will happen? Can you see here? All are reversible step. Can you see above pyruvate kinase, phosphoenol pyruvate, all are reversible step. Conversion of phosphoenol pyruvate to pyruvate is irreversible. This is done by pyruvate kinase. Can you see this all? Now what will happen when pyruvate kinase is deficient? This will be very high. And you know reversible reaction is driven by concentration of substrate and product. So what will happen ultimately, if this is high, the reaction will somehow become this direction. Okay. And then it will go this direction and this direction. Okay. Now you can see for conversion of this to this require ATP. Is that right? And somehow in RBC, what happens is, you know, I told you this 1,3-BPG or DPG converts into 2,3-DPG. DPG, or you can call BPG. Is that right? Okay, because of mutase enzyme, and this directly converts into this. There is lack of ATP production. So what ultimately what will happen is ATP consumption at this step. This was one of the ATP production. Because this is deficient, ATP production cannot happen at this place. Okay, now ATP production that is happening at this place is also interfered. Is that clear? Because of accumulation of this phosphoenol pyruvate. Okay, so this will be high here, and phosphoenol, because of this phosphoenol pyruvate, and then ATP synthesis will also be disorder. So you can see here in pathogenesis, I have shown you. So pathogenesis in pyruvate kinase, you can see this is very high. Okay, when it is deficient, accumulation of phosphoenol pyruvate will happen. Same thing I have written in Word. Okay, so you can see the pathway and you can understand yourself. Now when it is high, so 2,3-BPG will also be high, and then this will cause utilization of ATP and hemolysis. Did you get me now? Okay, and if you did not understand, you can go back to this video. This is in recording. Okay, you can come back to this video and you can watch the pyruvate kinase deficiency pathogenesis. Okay, what is the presentation? Jaundice and anemia. Okay, so only you can see only pathway you will study here. This is the only pathway where you will find jaundice and anemia in whole disorder. So when you take NBME, question will not come from other place. The question will come from this only, this disorder only. When you find this disorder, so when you find this jaundice and anemia, yes, rupture of RBC. When you don't have ATP, what will happen? The fluid, there will be mineral imbalance. Fluid will go inside the RBC. Okay, when you don't, when RBC does not have ATP, to maintain that electrolytic balance. So there will be RBC rupture and hemolysis. You are right. So you can see jaundice. Aggravating factors of this: infection, iron, toxicity, even high glucose level can cause hemolysis. Okay, these are the aggravating factors. So in question, you may get this clue. Okay, in all disorder, in summative exam also, whenever you find jaundice and anemia, you can easily guess that this is a pyruvate kinase deficiency. Okay, it's simple to approach question right now. Okay, so PDH deficiency. PDH deficiency, you know, PDH deficiency happens congenitally. Okay, it happens because of gene mutation. Plus, it can also be acquired. Pyruvate dehydrogenase deficiency. The most important question they actually ask is from acquired pyruvate dehydrogenase deficiency. They generally don't ask question from inherited disorder, because inherited disorder is very rare. So how this PDH deficiency is acquired? Because you know, pyruvate dehydrogenase complex depends on 5 cofactors. Among that, 4 are in vitamins: vitamin B1, vitamin B2, vitamin B3, and vitamin B5. They require this 5 vitamins. And when vitamin B is deficient, then it will also affect pyruvate dehydrogenase. Did you get me? So this is how vitamin B1 deficiency associated with pyruvate dehydrogenase deficiency. Activity of pyruvate dehydrogenase will go down. The Warnick syndrome is the syndrome which is related to. Yes, pyruvate dehydrogenase deficiency does cause lactic acidosis. Okay, it is neurometabolic disorder. Your nervous system is affected. Okay, plus metabolic acidosis, lactic acidosis will be there. Okay, did you get me now? Okay, now 5th disorder is mitochondrial disorder. So you will see mitochondrial disorder, you will read in like elaborated form in genetics. Here I have included this because of lactic acidosis. Any problem, almost all mitochondrial disorder, they have lactic acidosis, because the glucose, the NADH that is produced will not be converted into, you know, useful ATP. So you can see this question. Just do this question quickly. You can see this point: mildly elevated hyperglycemia. His father, means there is no skip generation. Okay, it is present in F1 generation, first generation, after father also. That means it is autosomal dominant disorder. Patient is not obese, so there is no cause of diabetes. Okay, obesity is also one of the cause of diabetes. So obesity is not the cause of diabetes. In diabetes, generally you have lipid level abnormality. Okay, and then does not have antibodies therapeutic. So there is no antibody that will kill the pancreatic beta cell. So these are they rule out all the causes of diabetes. So alteration in glucose homeostasis may be due to mutation in which of the following. So this is autosomal dominant disorder. Okay, mildly elevated hyperglycemia. When you see the choices, you can find glucokinase. So it is MODY. Okay, it is MODY 2, maturity onset diabetes of young. It is because of glucokinase. You have seen 2 glucokinase are there in choice. Actually 3. If you have to choose among them, you will have to pick pancreatic glucokinase. Okay. So for this, you'll have to understand the concept of insulin secretion. Okay. This is the most accurate answer. This is also not wrong, but this is the most accurate answer. You got me?
But sir, you
Because
told us about the liver is the mother and the brain is the child and glucokinase.
yeah, I did that, but when liver is only there, this is the choice. Okay, this is right. This is not wrong answer. This is right answer. But when pancreas, I told you the glucokinase is present in beta cell of pancreas and then liver. Do you recall that?
Yes, sir. We
Yeah.
really remember now.
Yeah. When there are two choices, you'll have to pick this choice because it is somewhat related to diabetes because of somewhat more related to insulin secretion. Okay. So one pathogenetic mechanism is that this glucokinase will not take up. Other mechanism, insulin is not secreted until very high level of glucose is reached. Because of glucokinase, lack of affinity of glucokinase for glucose. Okay. Did you understand? Let's go to other question. Okay, you can read this. Okay. Now let's, both are same. So when you see pancreatic, you just have to put on pancreatic glucokinase. Okay. So let's see this question. You can see mitochondrial disorder, they will ask question, but they will not, they will just write like this. DNA mutation. This would have difficulty in which of the following electron transfer? You are mute, on mute. You are mute, Thomas. Okay. What is the answer here? Be quick because we have other questions also.
D, sir.
Is that D? Yes.
D.
So you can say this question is not straightforward. Okay. So they have, since it's from mallet state, they also indirectly asking you a question from if you know TCA cycle or not. So mallet in TCA cycle converts into oxaloacetate. You know that. Here NADH is produced. And this NADH will join. It will, the electron will go from this NADH to complex 1 through Q, coenzyme Q. So it is asking it is, this question has included TC concept of TCA cycle also. Okay. So this is how question comes. They will link many things together. Okay. And it is, if you understand, it is not that difficult question also, but you have to understand, at least in order to tackle question, you have to be here. If you are here, you will lose marks, you will not get. But if you are here, somehow you will be able to tackle this question application. Okay. Some difficult question you will be able to tackle. Okay. So now see, you don't see answer. Okay. Just try to answer, then you can later see the answer. Okay. So what should be the answer for this?
C.
Yes, C. So these are all enzymes of glycolysis. Is that right? This is the only enzyme that is outside the glycolysis, after pyruvate. Okay. So this is the reason you'll say. Though this is cytosolic malate dehydrogenase, but this will, deficiency of this will also cause lactic acidosis. because it is required in mallet-spotted shuttle. Okay. Okay. So this is the question we have already done. This is not new question. Okay. So you can see this is one of the question. They can ask they can ask concept from your, if you know that TCA cycle or not. If you know the steps of TCA cycle or not, they can ask this way through this question. If you know the steps of TCA cycle, then you can think on this question. If you don't know, if you don't understand, just knowing is not enough. If you don't understand the steps of TCA cycle, you will not be able to do. You need to know the steps of TCA cycle. You need to understand the steps of TCA cycle first, and you need to have the concept of this lactic acidosis. Then only you will be able to solve this question. So you can see here from this succinate level, high succinate level, you can easily get this answer, because when succinate dehydrogenase is mutated, then only this succinate will be very high. And because of that blockade, it will backfire to the whole pathway and then lactic acidosis. Okay. What about this? Just don't see the answers, just try to answer this question from this only. Later you can see the answer.
Pyruvate kinase.
Yes, pyruvate kinase. So you can see this. Do you see the curve movement for pyruvate kinase? Right shift of the curve. Do you see the right shift of curve? Why is this curve has shifted towards right? This oxygen dissociation curve shifted towards right.
Decreased affinity for O2?
Yeah, yes, you're right. Decreased. Why decreased of affinity? Because in pyruvate kinase deficiency, if you can see here, 2,3 BPG level is high. Okay, because of that. So this is one of the indirect clue you can find. This is an indirect clue from question. You'll get that. Okay, 2,3 BPG is high. That is why there's shift in the curve. That means this actually make you very confident that this is the disorder of pyruvate kinase deficiency. Here for this module, you will not be confused because you have only one disorder that will cause hemolytic anemia. But when you take MSK1, that time this will help you a lot. Got me? Okay. Okay. So you can find the answer here also. I've also explained pyruvate kinase deficiency. Now let's talk about vitamin deficiency, and we'll be a little quick here. Okay. So you already know this thiamine is part of which enzyme? Thiamine is part of which enzyme? Vitamin B1 is part of which enzyme?
Pyruvate dehydrogenase.
Yeah, pyruvate dehydrogenase complex, and also alpha ketoglutarate dehydrogenase. Two enzymes that we have done till now. It is part of TCA cycle. It is part of bridge reaction. I call it bridge reaction. Okay. So when vitamin B1 is generally deficient in alcoholic patient. Do you know that? Alcoholic patient. Okay. And this alcoholic patient, the vitamin B1 is deficient, and then question generally come from this. That is why I have highlighted it. So when patient takes alcohol, it will cause vitamin B1 deficiency, and this syndrome is called Wernicke syndrome or Wernicke-Korsakoff syndrome. Wernicke syndrome is something that is related to, and gait, ataxia of gait, more with the motor function. And Wernicke-Korsakoff is related to confusion, whole sort of brain and motor both. Complicated, more devastating condition we'll call Wernicke-Korsakoff. Anyway, in question, when you get question, they will not differentiate between Wernicke-Korsakoff. They will just put the question directly. Okay. in the question, they will have this type of presentation. So you can remember the presentation that is associated with vitamin B1 deficiency because of alcoholism, cat's eye, mnemonics you can use. What will happen? C for confusion. At for ataxia. This patient will have confusion. So brain related memory is distorted. Confusion, confabulation is like memory is distorted. They don't recall things well. So they will make useless story. They have distorted memory. So they will speak anything. They have too much of confusion. And they have ataxia, ataxic gait. And eye will have nystagmus, and one eye will be looking at other side, one will be on other side. This is ophthalmoplegia because of weakness of eye muscle. So these three things you will see in such patients. And you can imagine this drunken patient, how they move. The same way there, I also move. One eye will look at this direction, other eye will look at that direction because of ophthalmoplegia. You can remember. So this will cause, this is a very important thing. Other deficiency, you can see vitamin, they can associate it with vitamin B1, B2 deficiency. Okay, so which enzyme contain vitamin B1? So you have to remember that. Okay, again, PDH, which enzyme contain niacin? So this is also one of the important thing. Niacin deficiency is also important, but generally question you'll get from this at this level. Okay, so niacin deficiency will cause pellagra, dermatitis, diarrhea, dementia. So they will give this presentation and they will ask which enzyme might be affected. So you can choose this vitamin B3 contain using enzymes, even including complex 1. Complex 1 is also enzyme that use vitamin B3. Okay, so this is pantothenic acid present where. That is why you need to remember the steps where vitamin is utilized. Did you get me? Why I ask you to remember the steps that utilize vitamin? Okay, let's do this question. A very straightforward question.
A.
So this is how they ask question indirectly from TCA cycle. So is it this? Yes, it is A. Okay, alpha ketoglutarate to succinyl coenzyme. It is catalyzed by alpha ketoglutarate dehydrogenase. This is the right answer. Okay, now let's see it. So this is extra slide you can read. Okay, they will actually, they don't give directly ataxia. They will say gait is not the wobbling gait, patient with wobbling gait, alcoholic patient. They will include all this. Okay, they will describe rather than mentioning this medical terminology. This is terminology. They don't give terminology directly. They will describe this terminology and make a question. You can see, and you can just read these other gait. I think you have done today, ICM on gait. So you can understand if they describe about gait. They talk. You can see this question, this team. You can focus on the more on this team. You can see who has recently become depressed. You can see this confusion has, they have included depressed and is eating very little and drinking alcohol. They will give clue of alcohol very heavily and present to you one day with noticeable swelling of lower legs. These are the presentation of a vitamin B1 deficiency. So this is how they give the question. Okay, and these symptoms have come about due to which of the following? So it is because of vitamin B1 deficiency. Though this is the advanced question, I have just put this question. We will talk about this question in vitamin deficiency. Okay, I've just kept this question here so that you will be acquainted. Ultimately, you will be doing this question after MD2. Is it right? So this they will describe this thing. Same thing. Ataxia, they will describe ataxia, they will describe ophthalmoplegia and altered mental status. Okay, and this is how they will ask question. And they will always put this clue. This is a very important clue. You will universally get this clue. Alcohol, heavy alcohol use. in Wernicke's encephalopathy, you will always get this clue. Okay. Then you can easily find out vitamin B1 deficiency. Actually, even if you don't see this choice here, no problem. So energy due to here, vitamin B here and here you have. So lack of energy to nervous system due to B1 deficiency. Lack of energy to heart due to B1 deficiency. So most of the problem you will see here is because of lack of energy to the heart and also to the nervous system. Okay. So
sorry,
lower
is it
leg
C or
swelling.
D?
So here you will have to go for, both choices are there, you'll have to go for D. Because the ultimate presentation, this all presentation has happened because of this D. This is also right answer, you know. This is the best answer. But this type of question will not be asked right now. Don't worry about it. Just I wanted to introduce this system. Okay. Which of the following enzyme would suffer because of this disorder? So you'll need to, this question can come. Which enzyme suffer? You know the pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase. This is how question come from application level. They indirectly ask you question, every question, each, they can ask any question, in-depth question from pathway. This is how they ask question. Okay. So you can read the explanation also. Okay. So third, you can see this. 5 raw eggs as dietary regimen. Okay. After 1 month, develop alopecia. This is a very patchy alopecia is very important presentation in biotin deficiency. Red dashes on face started getting tired. Tiredness is also associated with vitamin biotin deficiency because biotin is required by which enzyme? This is biotin deficiency because a raw egg has avidin that will bind to biotin, won't let biotin absorption happen. So this is C. So if you know that this pyruvate carboxylase utilize biotin, then you will be able to solve. That is why from the beginning I was telling you ABC, 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 ABC. I have repeated many times. I think you must remember right now. So this is biotin containing, all carboxylases are biotin containing enzyme. So we can say avidin in raw egg, bind biotin, okay. Now we have done our vitamin deficiency also. So let's see inhibitors, okay. So these are the inhibitors you can see we have done till now. These all inhibitors are very, very important, okay. Especially when you talk about this electron transport chain, especially couplers, and this are very important. Now let's, you know the fluoride inhibits which enzyme?
Enolase.
And do you know the use of fluoride in laboratory, medical laboratory?
Two bisphosphoglycerate to phosphoenol pyruvate.
Yeah, but in medical laboratory, it is used fluoridated fluoride vials. I'm giving you, okay. So I'll show you on Google, I'll show you. So you can see these are fluoridated vial, okay. They will add in vial, they will add, can you read this? Sodium fluoride. On this label. Just tell me if you can read or not. Yes? Yes. So this is a vial. You can see this vial. Inside the vials, there is fluoride, sodium fluoride is coated. What does this sodium fluoride do? This will inhibit glucose utilization by RBC. This will inhibit glucose utilization by RBC by inhibiting glycolysis, so that glucose concentration will not fall. And ultimately, you will be able to measure that glucose precisely. If you don't add fluoride, what will happen? Glucose level will fall and you will not get desired precise, accurate level of glucose concentration in blood. Did you understand, Jerem?
Yes, sir.
Okay. So this is the use
So
of,
it will inhibit NOLS, but it will go back up, right, to the 1,3-bisphosphoglycerate. And do you understand what I'm saying?
no, enolase is here. You have to see it. Enolase is here. Okay. Enolase is somewhere. You can see enolase is, this is phosphoenol pyruvate to this, and enolase is here. Okay. Okay. This is enolase. And somehow what happens is when product are accumulated, this glucose will not be utilized. They may produce many 2-3 BPG, but it will not have that significance. The glucose available there will not be converted into the pyruvate. Somehow it will inhibit glycolysis. Okay. Okay. So, okay. Okay. So let's see this. You understood this fluoride use. Okay. Now arsenate is a very important inhibitor. You know, arsenate inhibits switch off. It also inhibits glycolysis and TCA cycle pyruvate dehydrogenase. The lipoic acid of pyruvate dehydrogenase and alpha ketoglutarate dehydrogenase. So arsenate is a very important poison. So when they ask question, they can give skin cancer. Okay, they have skin cancer. This patient arsenate poisoning, chronic arsenate poisoning can lead to skin cancer. Okay, some ECG changes can happen. Actually in acute poisoning, but in chronic poisoning, you'll see skin cancer. And this will happen in endemic area where the groundwater has very high content of arsenate. Okay. So this arsenic poisoning will inhibit which? At least remember this. This will inhibit both enzymes of Krebs cycle and glycolytic pathway. Now, fluoroacetate will inhibit aconitase. Remember this. Okay. Malonate will inhibit what? Malonate will inhibit succinate dehydrogenase because malonate is very similar to succinate in structure. Okay. Malonate is very similar to succinate. That is why it is a competitive inhibitor of complex 2 or also called succinate dehydrogenase. Now, electron transport chain inhibitor we have done today, but I did not tell you about all the inhibitors. So this is the very most high point about this electron transport chain inhibitor. This all electron transport chain inhibitor, they will reduce ATP production and also reduce O2 consumption. Is that right? You remember this? Everybody remembers this? ETC inhibitor will inhibit both ATP and O2 consumption, ATP production and O2 consumption. While on-coupler will inhibit only one. It will increases O2 product. Rather, it increases the consumption of O2. Okay, so let's first do some question. Then I will go to the slide of electron transport chain inhibitor also, because I have to say something. We did not complete all. You can see this question. Just do this question.
Cyanide.
Is it cyanide? Don't forget this. This is a big clue. Elevated temperature is not there in electron transport chain inhibitor. I told you when car break down, it will become cool. Yes, when your body breaks down, it will become cool. It is not producing ATP. Now, it is also not producing, cyanide poisoning will also not produce heat.
It's an uncoupler.
It's
inhibitor.
on coupler. It's on coupler.
So I know it's an uncompla, but the rest of this drug looks strange to me. So I don't know which an uncompla.
No, I'll come to those drugs. Don't worry. So that is why like this is on coupler. At least with you could have told me on coupler rather than directly jumping to the this
I thought of
options. You could-
uncoupla. Cyanide was the first thing that came to my
No,
mind.
cyanide is not an on coupler. It is electron transport chain inhibitor. You know that. Okay. So at least you could have told me on coupler. Okay. Because of this temperature. You got me? So then we will, we would have done inquiry which uncoupler is this? Which of the following is uncoupler? Let's go to the slide of this oxidative phosphorylation. Then you'll understand. Let me give you, just see the list of, can you see the slide? Electron transport chain inhibitors. Can you see? Tell me yes or no. Okay. So you can see here electron transport chain inhibitors, name of inhibitors. Especially you need to remember this complex 4 and this 2 is very important. Complex 4 and complex, these are very important. Okay. I have marked this wherever you find. I want you to remember this only one. Here I want you to remember one. I've already given you malonate. There, malonate is competitive inhibitor, and one is BAL. BAL has 3 letter in it. That is why it is. You can remember to you use the trick. 3 letter means it is inhibitor of complex 3. A is the first letter. It is inhibitor of complex 1. That is how you can read. Just you have to memorize the word. Easy. Okay. Now these are the inhibitor of complex 4. Cyanide, carbon monoxide, hydrogen sulfide. These are all inhibitor of complex 4. And A attractoloside, A for AT, at for ATP, you can remember. So they attractyloside, it inhibits the exchange of ATP ADP through inner mitochondrial membrane. This is somehow you can easily understand attractor ATP inhibitor. So okay, the transporter ATP transporter inhibitor. FO oligomycin inhibits F0 complex. So do you remember this? There is 2 complex. The complex that is there in the membrane is called F0 complex. And the complex above the membrane, this is called F1 complex. Do you remember? Do you know that? Here, complex 4, you can see F0 complex, and this is F1 complex. Now, did you understand? So this oligomycin will inhibit F0 complex. That's C, that will. O for oligomycin, O for, you can name FO. These are the inhibitor you need to memorize, okay? And now in carbon monoxide poisoning, what is the antidote? 100% oxygen. Okay, what is the source of poisoning? Main source of poisoning is combustion. What is the presentation? These are the presentation. Okay. And cyanide poisoning, these are the source of cyanide poisoning. Drugs, nitroprusside drugs, combustion of furniture. Okay, the furniture has this polyurethane coating, this coating, that when it burns, it has cyanide. You can see here cyanide, thiocyanide. It will release cyanide. Drugs has nitroprusside has cyanide. So when that cyanide can release from that iron and then cause toxicity. Gold mining and metal extraction also, and that is why when house is on fire, you get both poisoning. Carbon monoxide and then this cyanide poisoning. And cyanide bind ferric ion, not ferrous ion, it binds ferric ion. Okay, so these are the tachycardia. Tachypnea means high respiratory rate, high heart rate. These are the presentation of both inhibitor and coupler. So these are the antidote. So 4, you can see nitrite, thiosulfate. You can read this, how it inhibits. So mechanism is also written. I want you to read. Okay, thiosulfate and then hydroxycobalt. So on coupler, these are the on coupler. You can see 2,4-DNP. DNP means dinitrophenol. Dinitrophenol. This is the DNP, 2,4-DNP written. Can you see? This is pathologic on coupler. There is something called physiologic on coupler. So physiologic on coupler you will find in baby in brown fat. So that keeps baby heated. Okay, that is present in the brown fat. Brown fat are distributed along this area. You can read this. Mid axillary region. Okay, between these two scapular region around kidney. Okay, below sternum, brown fat is present here. So these are the normal tissue that have on coupler, which is protein is on coupler here. And that is meant for a purpose to heat the baby. Okay, but other pathologic on coupler, these are the pathology. Most frequently, you need to at least remember this one. They actually cause poisoning. And you can see one drug, when you use this drug in aspirin in high quantity salicylates, it will also act as on coupler. So these are the examples of on couplers. Okay. So it was sometimes, one time it was used as, you can read this snapshot of this magazine. It was used as a drug slimming pill used to reduce the weight, DNP, because there is no ATP production. ATP is basically a brake. ATP is a brake in metabolic pathway from glycolysis to TCA cycle, right? So you are removing a brake. Brake is not formed, only heat is produced. So now let's go to the main slide again. Okay. And now, Sharon, will you be able to answer question?
Yes.
Now you can see rotenone it is also a electron transport chain inhibitor. Dinitrophenol is a on coupler. Oligomycin is also inhibitor. Atractyloside is also inhibitor. Cyanide, all are inhibitor.
Sir, so if there's no ATP in the couplers, the glycolysis will happen faster, right?
Yeah, if on coupler is there, it will make all the pathway very fast. Because ATP
but
is
there's
not,
no energy.
There's heat, energy in the form of heat, which our body cannot utilize.
But no ATP.
No ATP. ATP based on the concentration of on coupler, ATP production drops. Okay, if you take too much of on coupler, it will kill you. Okay, now you can see this. You can read this explanation. Now you just do this question now. What does oligomycin do?
Complex 5 inhibitor.
It is complex 5 inhibitor. So what is the answer here? There's no complex 5.
It's E.
E is the answer. So you have to, if you know the function, this is what understanding. If you know what is ATP synthesis, you'll be able to answer this question. Otherwise, you will be very blunt. By exclusion, you can pick this answer, but when I change the other option, you will be pretty confused with this option. So this is the answer. You have to understand what is the function of complex 5. Okay. Okay. No problem. So I think now regulation, I think you will, you can go, I'll talk here and you can see the video later. Okay. Okay. So regulation, you can see these are the regulatory enzyme. The most important regulatory enzyme is here. So we'll have here canogen and many people are there. They have joined. Okay, no problem. Okay, so we have here rate limiting enzymes are there. Okay, see, these are all rate limiting enzymes. You can see from glycolysis till this. So we have 10 steps where rate limiting. So glucokinase, you already know this is also. And pyruvate phosphofructokinase is the most important among all these. Okay, among all these. So what is the most important inside that phosphofructokinase? This fructose 2,6-bisphosphate is the most important. And that fructose 2,6-bisphosphate is under regulation of insulin and glucagon. You know that. This is the most important part of this. And they will ask, high insulin and glucagon ratio will cause what? High insulin glucagon, when insulin is high, it will cause increased synthesis of fructose 2,6-bisphosphate. When glucagon is high, it will cause decreased synthesis of fructose 2,6-bisphosphate. Okay. Now pyruvate kinase, these are the allosteric activator and inhibitor. So alanine, ATP, and then fructose 1,6-bisphosphate is inhibitor, activator. Sorry, feed forward activator. It has direct effect of insulin. So you can see insulin will do dephosphorylation and phosphorylation. The pyruvate dehydrogenase. So pyruvate dehydrogenase is also an important enzyme. Okay, these are inhibitors. Okay, so direct effect, you can see high insulin and glucagon ratio. You can go back to lecture and you can see this all about this pyruvate dehydrogenase. Okay, so you can remember ATP, NADH, and acetyl coenzyme. These are inhibitors. I want you to read this yourself. Okay. Okay, so pyruvate carboxylase, second very important thing. Don't forget this. Acetyl coenzyme is activator of pyruvate dehydrogenase. Elsewhere, you will see acetyl coenzyme is an inhibitor. This is the only place you will see acetyl coenzyme is activator. Okay, every places acetyl coenzyme is an inhibitor in glycolysis. Here only you will see acetyl coenzyme is activator. So alpha ketoglutarate, if you know the reaction, it will be very easy. These are the product. This product inhibits. Isocitrate dehydrogenase, these are the product of isocitrate dehydrogenase, and NADH will inhibit. Okay, activator is ATP. Citrate synthase, ATP will inhibit. ATP is for universal inhibitor. You can see where everywhere ATP will inhibit. If ATP accumulates, it will inhibit all the process. Okay, and that is what happens on copper. ATP is not synthesized on copper. ATP works like a brake. So brake is not there in pathway. So pathway will be very wide, very speed pathway will be very speedy. So electron transport chain control. There's no influence. They all have no influence of insulin. Insulin has influence here only on glycolytic, mainly glycolytic pathway and pyruvate dehydrogenase. So in whole of this pathway, if you see insulin effect where the direct effect you will see in two enzymes. Enzymes that name of that enzyme starts with pyruvate. They have direct effect. And this phosphofructokinase have indirect effect. Rather than writing this terminology, let me write indirect effect. Okay, then it will be more clear. It has got indirect effect. Okay, indirect effect. Okay, so these are the in regulation. So this is a very important point. Don't forget this. Okay, don't forget this point. And when insulin is high, these are the pathways that will be favored. You see glucose oxidation. We have done glucose oxidation. That will be favored. Glycolysis, TCA cycle, these are favored. When in fasting condition, what will happen? This glucagon will be high and this other fasting enzymes pathway will be active. Okay, so you can remember this. So this is a formula you have to remember. Many questions come from this. Okay, these are the all the inhibitors, all the activators that we have studied in glycolytic pathway, except acetyl coenzyme. Acetyl coenzyme is inhibitor elsewhere, except pyruvate carboxylase. Pyruvate carboxylase, it is activator. Okay. So basically, high energy condition will inhibit glycolysis. For example, ATP will inhibit the glycolysis. NADH will inhibit the glycolysis. This coenzyme A are inhibitors. This signify high energy condition. Okay, and fasting condition are also inhibitors. These are the activators of glycolysis, especially glycolysis of hepatocyte. Okay, so child brought in with, this is the question from this, okay, regulation. So child brought in with a suspected enzyme deficiency, child is jaundiced and has icterus, okay. Chemistry, functional, this. Protein kinase A is missing. Protein kinase A also means CMP dependent kinase. Just don't forget that. Dependent protein kinase is absent. Which of the following enzymes is affected by absence of pyruvate kinase A activity? Which enzyme will suffer because of absence of pyruvate kinase A? Which enzyme actually follow the instruction of pyruvate kinase A here? Which enzyme follows the does this follow the instruction of this? No, this does not follow instruction of pyruvate phosphofructokinase, does not follow the instruction of this. This actually, this is the answer, okay? Why is this answer? This enzyme is not regulated by anything. There is no influence of insulin here, insulin or glucagon. There is no influence of insulin or glucagon here. Okay. So adenyl cyclase comes before that. Okay. CAMP comes before protein kinase A. It comes before. That is why it is not affected. The enzyme that comes after this will be affected. Okay. So this is not affected. So this is not the answer. Phosphofructokinase 1. It is not, it is a fed enzyme. So it is regulated by insulin. Insulin affects it. So it is not affected by glucagon. So it will not affect that. So this is the answer, you know, this enzyme, it will somehow convert fructose 2,6-bisphosphate into fructose 6-phosphate in fasting condition. This is the enzyme that is helpful in fasting condition. Go back to that slide. Glycolysis, then you will understand here. Okay. Now let's come to, without wasting other time, let's see this. So substrate and energetics, you can go over this. You can easily remember them. So you can just understand that you may get this picture and you will be asked which step has this problem. I may give number here, okay? Let's see this step 1 and then 2, 3. So which step has NADH production, which step has ATP production, and you'll have to answer. So that is why you should be very acquainted with the pathways. Now, energy yield from complete oxidation of acetyl coenzyme to carbon dioxide is following. High energy bond. So they indirectly ask question. How many ATP is produced from one acetyl coenzyme A? The answer is 10. 10 ATP from per acetyl. So other question, I want you to practice yourself, okay? So these are the main thing I have revised, okay? So most of the question will come from here. And we can do one more revision before NVMe. Okay? So can we, shall we end here? So any question, you guys have any question, you can ask in WhatsApp group, okay?
Thank you, sir.
Okay.
Thank you so much.
Okay, you're welcome. So I'll be happy to answer those questions, okay? So thank you. I'll end this review here, okay?